Hi, I'm Dr. Paul Ruff, Medical Director at West End Plastic Surgery, and I'd like to take the opportunity to talk to you today about hair transplantation. It's one of the exciting offerings that we have at West End Plastic Surgery. With the advances in the medicine predictability, this has become probably one of the greatest treatments that we have within our practice. Hair transplantation can be performed through a variety of different methods. One of the traditional methods is follicular unit transplantation, or the strip method, and it has its certain advantages. And then the newer methodology is follicular unit extraction. And the device that we have in our practice is NeoGraft. And we've done a lot of research, evaluated different options, and have felt that this actually provides our patients the most advanced way to harvest, extract, and prepare for reimplantation, thereby improving the overall outcomes. Follicular unit transplantation, or the strip procedure, is always going to be a necessary and appropriate option for certain people. It removes a strip in the back of the hair, usually what we call the high density donor site area, but does leave a linear scar. For patients who have longer hair though, that strip can be covered by shaving just a small area. But the follicular unit extraction, or the FUE, done by the NeoGraft process, allows us to pick and choose hairs from a variety of areas. The biggest issue is minimizing recovery time. The follicular unit transplant can have more discomfort, a little bit more swelling, whereas the FUE process, although having to shave the donor site areas and so wearing your hair cropped, can offer a much easier recovery time. So who are the best candidates for this procedure? In our practice, we see a wide variety of ages, from patients in their 20s to patients even in their 60s. Patients who have thinning or recessive hairlines to bald spots on their crowns. Men and women are both candidates. I think this is more of a male-dominated treatment, but we see women postpartum alopecia, generalized aging-related alopecia. All of them are excellent candidates for this procedure. Postpartum hair loss is a very common concern, affecting up to 40 to 50% of women. Patients will oftentimes start seeing hair shedding within a few weeks after delivery, and that can last many months. Most of the time it's temporary. On occasion, it persists. And if it persists, it can persist diffusely or in small patches. And this is where the NeoGraft procedure really shines. It's been traditionally used on the top of the head. I think everybody's very aware of that. But with increased improvement in extraction and understanding the hair follicle and support of its growth, we can use it for a variety of new off-head areas, including eyebrows and beard. And I think those are probably some of the biggest areas of advancement, even mustache areas. Best candidates for facial hair transplantation are those who have either lost their lateral or outer eyebrows through natural means or overplucked them, which is not uncommon. Patients who have had or seen patchy mustache or beard growth, or just lack of growth. These patients are excellent candidates. Another group of candidates for whom this is a great procedure are those who are transitioning. The female to male patients who have adequate hormonal supplementation oftentimes don't have full beard growth. The NeoGraft procedure is a powerful option for patients going through transition, as it helps alleviate the dysphoria and really allows them to see the person that they want to see staring back at them. This treatment actually works on hair of all types, from blonde to black to red, as well as straight hair, wavy hair, and even afro hair. That is one of the nice advantages of the NeoGraft procedure. It is somewhat blind to the type of hair, not dependent upon some specific hair characteristic. These procedures can take just a couple of hours up to nearly an entire day. And the length as well as the cost of the procedure depends upon the number of grafts that we are harvesting and planning to implant. The day of the procedure, the patient's hair gets prepped. That includes shaving. If it's a small area to be harvested from, sometimes that can be hidden, depending on how an individual wears their hair. Obviously, larger procedures require a more uniform shaving so that we have a larger donor site area to deal with. Everything is numbed up. We use long-acting numbing, so this is a very comfortable process. Anybody who has a little bit of anxiety, we also have options to be able to help alleviate any of the fears during the procedure. The post-procedure recovery is fairly straightforward. Patients can typically return to most of their daily activities within 1 to 2 days. They may be aware of some swelling, a little bit of sensitivity, but not significant pain. Back to full-fledged activity within 5 to 7 days, including strenuous exercise. Washing the hair, everybody will need to do that, and there are specific methods to be able to protect the grafts. As far as what you will see over the next few weeks, swelling will go away. There will be about a 2 to 4 week period where you may see some shedding of the hair shafts that are been transplanted. And then around 4 to 5 months, you'll start to see some regrowth. And I think most patients start to see really significant regrowth around 6 months, but that's not the end point. The end point is really somewhere between 12 to 18 months down the road. At that point, when we're doing these types of cellular technologies, and I think this is a cellular technology, we really start to see the full effects. So what can you do to help facilitate the optimal results? Before the procedures, we're often doing stimulatory treatments like PRP, LED therapy, and these things are necessary post-procedure. Continued use of PRP or nanofat, LED therapy, and there are caps like the capitalist, and we have LED options here, are quite helpful. Consistency is probably the most important. One treatment really is not going to have much effect, but if you are consistent with your treatments, that will help ensure that you get the best possible outcome. I am a big proponent of nutritional support, and we like Nutrafol. That's the particular supplement that we like. I actually use the Nutrafol myself. I have seen great improvement in my hair. It also helps skin, which I think is kind of a cool side effect as well. Our NeoGraft team has been hand-selected. They are experts in their field, and they are here to help you through the process, guide you through the entire experience in order for you to have the best possible outcome. If you want to learn more about the NeoGraft procedure and hair transplantation in general, please visit our website at www.westendplasticsurgery.com, or please give us a call at 202-785-4187. Once again, I'm Dr. Paul Ruff, Medical Director at West End Plastic Surgery. We look forward to seeing you in the office.